special broadcast from Broadway Media.
Hi, I'm Bill Allred, and this is our third annual Out of the Darkness broadcast. It was September 23rd, 2008, when my brother, Noel Warren Allred, decided that life was just too much for him to bear. I didn't know that he owned a gun. He'd never talked to me about ending it. I wasn't worried about him. I rarely even thought about him. And that's on me. I should have kept my brother Noel in my thoughts all the time, and I didn't. Because I did know that he was going through a rough time. He'd lost a business that meant the world to him. He had no vocation to fall back on so that he could go back to work and earn a decent living. The center would not hold. And drinking alone in his living room, my brother Noel died by suicide. I like to believe that at the last moment, he thought, well, wait, what did I just do? God, how stupid. But that's just a small comfort to me. I don't know what he was thinking because I wasn't thinking enough about him. My brother Noel Allred would have been 62 years old this past summer, but instead, he became a number in a grim statistic. The state of Utah saw a 46.5% increase in suicide between 1999 and 2008, according to statistics from the Centers for Disease Control. In 2017, suicide was the 7th leading cause of death in the United States. Together, suicide and self-harm cost our country $70 or more billion in direct medical and work loss costs. As of 2016, Utah ranked 5th in the nation in the rate of death by suicide. It was also reported that suicide was the leading cause of death in children, ages 11 to 17. And how are they doing it? Well, nearly half of them use guns. Some see suicide as a mental health issue only, and indeed mental illness does factor into many suicide deaths. But it's more than that. As originally reported in the Washington Post, among the stark numbers in the CDC report was this. In the 27 states that use the National Violent Death Reporting System, 54% of suicides were by individuals without a known mental illness. They were suffering from other stressors in their lives. In 1999, as the rate of death by suicide continued to climb, the U.S. Surgeon General David Satcher said that suicide was not simply a mental health issue, but a significant public health problem. And in my words, it could even be viewed as a public health crisis. When Satcher made his remarks in 1999, the national suicide rate was around 30,000. The latest figures from the CDC, they're for 2017, they went from 30,000 to 47,173, and it continues to climb. We're going to visit some panelists now and talk with them about this. If you have any comments during the show, you can text them in and they'll get to me one way or the other. Just text your comments or questions to this short number, 33986. And when we come back, we'll talk. Is suicide more than a crisis? Is it an epidemic? We'll meet our guests and we'll discuss.
Although life can feel hopeless, DoTerra joins many friends and neighbors to support those looking for a way out of darkness. This is Missy Larson, the founding chair of the Safe UT app. There are many prevention tools and programs in Utah. If you or a loved one needs help, download Safe UT on your smartphone to access free crisis support. If you see a need at work, follow DoTerra's lead to sign up as a corporate Hope Squad. DoTerra is changing the world one drop, one person, one community at a time.
Hi, and we're back. I don't know, where am I looking here? Where am I? Yes. Which, I'm trying to figure out which camera. Oh, there we are. Hi. Welcome back to Out of the Darkness. Again, if you have any questions or comments during this discussion, 33986 is the number to send in a text message. Now we're going to meet our panelists for segment one. First of all, Allison Whitworth. Hi, Allison. Allison is the state Suicide Prevention Coordinator. She co-chairs the Utah Suicide Prevention Coalition and works to support and implement state suicide prevention programs by engaging community leaders and organizations in evidence-based strategy. Allison is also a certified health education specialist. Did I get that? Also, we have with us Will Levitt. Will graduated from the University of Utah with a BA in communication. He worked in advertising and medical sales before finding his true calling in mental health. Thank God you got out of advertising. Before working with SAFE UT, he worked as lead psychiatric technician on an adolescent inpatient unit at the University, up at UNI, at Neuropsychiatric Institute. And he is very passionate about adolescent suicide prevention. Also here, just to my immediate right, State Senator Daniel Thatcher. Dan has been in the legislature since 2010. He is a member of the Utah Sentencing Commission, the Mental Health Crisis Line Commission, and the School Safety and Crisis Line Commission. He's most recognized, though, I think, for his work on the Safe UT app. Helping to pass Utah's hate crimes laws is also something that Dan is very passionate about, reforming criminal justice, and he lives in West Valley with his lovely wife, Summer. Nice to see you, Dan. And then, of course, we have, last but not least, Taryn Hyatt. Taryn is the Utah, Nevada area director for the American Foundation for Suicide Prevention. Taryn is a survivor of her own suicide attempts. She is passionate about the issue. Her father, Terry Aiken, passed away on October 5th, 2002, death by suicide. Taryn is a very passionate advocate for change. She has written for the U.S. News and the Huffington Post. She's testified before congressional members in Washington, D.C., before the Utah legislature. She's a recent graduate of Utah Valley University, getting her bachelor's degree in psychology.
BS degree.
Yeah, a BS degree, indeed. All right, thank you all for being here. This is the first segment, and we'll talk. Let's talk about it as a public health crisis. Allison, on the utah.health.gov website, it says suicide is a major public health problem in Utah, and it gives a lot of statistics about that. We are the 5th highest in the United States, I think, as of 2017, for people 10 years and older committing suicide or dying by suicide. Can we say then that it is an epidemic here in Utah?
So I think that, suicide is a very complex issue, and there are a lot of things that play into this. And so there's not one sole cause. And therefore, we really do need to have a comprehensive approach when we talk about suicide, meaning that all of us here on this couch, as well as hundreds of other individuals, are dedicated to this issue and hoping to keep the numbers from escalating. Just go back to the question, though, epidemic proportions. It seems to be getting worse rather than better in a lot of the 10 leading causes of death I read, only 3, and I forget what the other 2 are, but only 3 continue to escalate. Yeah. We've been able to arrest and or at least halt the progress of other causes of death, or certain cancers, heart disease, that kind of thing. But suicide continues to go up. That says epidemic to me. Yeah, unfortunately, we have seen our numbers rise, and this is something we're trying to get a hold of to hopefully get a handle on this so-called epidemic.
We require, when kids are in school, we require them to get certain health checkups. We want to know about their immunizations. We make it a point to say, at least the very basic health checkups and that sort of thing. And then we encourage adults, and I think most adults get regular annual physical checkups. But this is all health-related, physical health-related. Can we not have some sort of mental health checkup as well?
Yeah, we would love to see that.
Well, I would like to see the state mandate it, is what I'm going to say. You have to get a mental health checkup when you get it's as important as your vaccinations. I don't know, Tara and you can jump in at any time.
Sure.
I know you want to.
I think especially as we look at youth, we know that most people will experience their first onset of a mental health condition by age 11. So absolutely having a checkup from the neck up is the term we use, is vital. Because a lot of times what's happening is they're experiencing the onset of depression or anxiety, but not understanding, what the symptoms are, what they're experiencing. So starting with education in our schools is huge, and we've started to do that, but we need to increase the focus on talking about mental health. What can it look like? What would I be experiencing? And then get treatment. We know 2 out of 3 teens are not getting treatment for depression. And while depression is considered one of the most debilitating of all mental illnesses, it's also the most treatable. And so we need to recognize it sooner, get folks help sooner, and I agree. I think that's something we should all be seeing is getting that.
I mean, it really is. I think back, it's been a long time since I was in public school system, but you did have, you'd have certain sections on health, and they tell you, good hygiene and how to take care of that, and maybe they talk a little bit about the birds and the bees and how to not get pregnant a little bit, but very little, which we could have another panel about that. But nobody ever really talked about your mental health. That just wasn't part of it. Now, that was a long time ago. Has that changed at all? Does anybody know?
Yeah, that is changing.
It is changing. Right. Get as close to your.
Sorry.
Yeah.
So the Board of Education this
star.
year is implementing mental health awareness and mental health education in the classroom, and it will be a component of the health class. So, Safe UT specifically working with the Board of Education, that will be a component to it as a resource for these kids if they're struggling or if they know someone that's struggling, that they know how to use it, how to download it, and they can get the help that they need. But that is a component this year.
I think probably a lot of it's been slow progress because this is a topic that people don't want to talk about. It's getting better, but people don't want to talk about suicide in particular. And also mental health is often seen, or a lack of mental health is seen as some sort of personal weakness. Yeah. And it is not that. It is an illness just like the flu or anything else. Is that correct?
Well, yeah, and if you think about, again, depression. Most of us, if we were vomiting, throwing up, I had diarrhea, I was sick, I would stay home. I would stay home and take care of myself. Yet when we're experiencing depression, our brain even tells us, no, go to work, push through, come on, you can do this, suck it up. And we get told that by others. And so really just shifting that focus and having compassion. The brain is one of the most vital organs we were given in our entire body. And it gets sick like any other organ. So we need to address it, get treatment for it, because we know treatment works. But again, those stigmas that people have, of themselves and culturally, we still don't see mental health in the way that we need to address it more meaningfully.
I mean, it's not just socially, I think, and culturally. Society sort of does say that you're weak if you're having mental health problems, but I think we say that to ourselves as well. I'm feeling really depressed. I'm feeling beside myself. Well, I'd better just buck it up and get going, and that's really hard to do. Allison, as you work with these issues, do you work with schools at all?
Yeah, so we actually have a team of 6 of us at the state now, which is really exciting. We've had a lot of legislative support to get more staff on hand over just the last year. Our team has grown a ton. And so we do have one person that works really closely with school-based suicide prevention and helping schools just sort of implement some of those mental health screenings that you're talking about. That's one of the things they're working on this year, as well as we work with a lot of sort of those safe school coordinators and things like that to just kind of think about how we can create a safe culture within schools, so working with not only the students, but our role is sort of working with the administration and seeing how can we make these kids feel safe, how can we make them feel valued, and so some of those things. So we do have someone dedicated to that on our team, which is really exciting.
You talked earlier, Allison, about that this is a problem, the suicide is a problem that has many causes. It can be mental illness, but not always. It can be just life stress, relationship troubles. For kids, it can be abusive relations at home, or just the fact that maybe your parents are having a tough time together, and that's affecting you and affecting your mental state as well. and or you know somebody who has died by suicide, and that somehow we don't really understand that, do we? I want to go. I just sidetracked myself, but we don't understand why that seems to happen, do we, Taryn?
Well, what we know is, there's a term that's utilized, especially with youth, called contagion. And when somebody dies by suicide, and again, the way that we as a community respond to that death, we can either prevent others from going on to attempt or struggle, or we can increase their risk based on how we talk about it in the reporting. So we do have to be careful. And what it's basically referring to is that a person might identify with that individual, and then when they see that they're now out of their pain, or they have that same experience, that becomes a contagious thing, the courage to act. So we really want to implement those stories of hope and resiliency, right? We want people who've expressed or struggled with suicide to share how they got through and recovered. Because if there's a contagious piece to this, then let's let the courage to survive become contagious. Let's start sharing those stories and making sure that we're providing resources and letting folks know where they can get help, talking about Safe UT, and again, making it safe to talk about what they're going through.
They say a lot of the things I read on the CDC said it's really best to attack the problem of suicide on a local level rather than try to have some sort of national. And Dan Thatcher, Senator Thatcher, you started talking about developing some sort of an app that would assist kids in school, the Safe UT. How did that come about? And that's really working on the local level.
So actually, I don't know how much time we have, but I did want to highlight, we do have one bright spot in all of this, and that is that we have seen a slight decrease in youth suicide rates. And I believe that it is because of the focus that we've had through the efforts of Safe UT and with the partnerships that we've had with educators. There has been so much focus since 2014 when I ran my first bill in 2014 that would have designated a 3-digit number in Utah. And unfortunately,
like a 911 number. Huh?
Exactly like a 911 number, but unfortunately, petty politics got in the way and it didn't happen. So instead, we created a commission. It was chaired by Missy Larson out of the AG's office, and we got together and talked about, look, the smallest child, if they know what a phone is, they know how to get police, fire, and ambulance. They can get crisis response for any physical threat. How many grown adults know how to get help for a mental health or behavioral health or suicide issue? And so that's what we thought about. We thought about, how do we connect with these kids? Well, if I can't get a 3-digit number and a kid can't remember a 10-digit number, the logical step is an app.
And it's worked wonderfully well, apparently. Explain exactly how the Safe UT, and everybody, you should download this app, parents and kids alike. So explain how it works.
So this app, literally, you push a button and it calls the National Lifeline number. So you don't have to remember the number. You push one button, and it connects you to Uni. It's 24 hours a day, 7 days a week, anywhere in the entire state of Utah. It is completely confidential. It is free to use.
So if you're feeling down, if you're having suicidal thoughts, you hit the Safe UT app. It'll connect you with, does it connect directly to your office, Will?
So it connects. Safe UT is kind of unique and alone in the nation, as it's the only app out there that will offer access to students, parents, and teachers to have the ability to either text or call with a master's level clinician like a licensed clinical social worker 24/7, 365, completely for free. And like Senator Thatcher said, it's confidential, so we don't hold any personal information. So these kids that maybe are fearful of the stigma of going and seeing the counselor or a therapist, if it's 2 in the morning and these negative thoughts start to pop up, they have someone there, a real life medical professional who they don't know and they don't know them, that will always be there and answer the phone. And
that's a great step ahead. It used to be when you'd call these lines, it would be a well-meaning volunteer who was there to kind of help talk you through. But now this is connecting with people who work at Uni, right?
Yeah. Well, let me be clear. A well-meaning person is actually really, really helpful for someone who is not critical. If you've got someone who is in a mental health crisis, they need that LCSW. They need that licensed clinical social worker with the master's level qualifications. But if it's somebody who's just struggling,
Yeah.
let's keep them. I like to liken this to like stage 4 cancer is when you are going to die without direct, immediate intervention. To me, I see what Will does as that stage 4 treatment.
Yeah.
You need the LCSW, you need that licensed clinical social worker. But on a stage 3, if you can talk to somebody on a warm line that can keep you from reaching stage 4, somebody who can express to you, listen, I see you, and you matter, and life is worth living.
I mean, that is, yeah, it's great.
There's that 15-minute danger window that we haven't talked about yet, but most suicides attempts occur within 15 minutes of the decision. So if you can help somebody get through that 15-minute danger window, they live.
We're going to have to take a break here. We will be back with some more panelists. Taryn is going to stick around, and I think we may have you back as well, Daniel. We'll take a break here. We'll be back. We're going to talk about some of the opioid abuse and how that contributes to this problem. We'll be right back after this.
At Stand for Kind, we imagine schools to be a place for students and teachers to feel empowered to speak up for themselves and for others.
At Stand for Kind, we believe that bullying is not a normal part of childhood. We believe that bullying is not just kids being kids.
1 in 5 kids will experience bullying this year, and when bystanders intervene, we know that episodes of bullying end in less than 10 seconds.
Will you stand with us and imagine a school free of bullying?
Visit Stand, the number 4, kind.com, and find out how we can create a culture where kindness rules.
We're back. Now we're going to talk about opioid abuse, and we have some more people on our panel here. Let me introduce Heidi Peterson. She is a certified prevention specialist with the Association of Utah Substance Abuse, and founder. I took this off the website, so you tell me if this is right or wrong. And founder of Synergy Wellness. Also, she.
That's actually not me.
That's not you. That's a different Heidi Peterson.
That's me.
Tell me who you are then.
So I am a program manager and regional director with the Division of Substance Abuse and Mental Health, and super happy to be here. Thanks for having me.
I did know that, but yeah. So then you tell your office they need to send over a bio next time, okay? We have Tyler Hansen. I know this is Tyler's bio because he sent it to me. He was born in Orem. He attended Mountain View High School. He became a heroin addict because of sports injuries and a way to deal with the loss of losing his mother when he was on an LDS mission. That addiction led him to countless treatments and also a 2.5-year stint in the Utah State Prison, the Gray Bar Hotel, as they say.
Yes, sir.
Tyler loved learning, though, and in the setting of prison, he learned to love therapy, and he became an advanced substance abuse counselor. Currently, he's at school. You still go to school at Brigham Young, and he's in the master's program there, pursuing a clinical social worker's license. And he also has a recovery center called Steps Recovery. Is there more than one of them?
Yeah, there's 10 of them.
10 of them. And then he has a little spare time for 5 children and a supportive wife. And we have also with us Doug Wild. Doug is the fine creative director for my company I work for. I don't own it. Broadway Media here in Salt Lake. He's had his own struggles with addiction and was led astray by opioids. But Doug has persevered. He has reversed and reinvented himself. When I first met Doug, he was a creative kid, but he had a lot of problems and he got fired. And then Doug came back and said, "Can I have a second chance?" And I've cleaned up, and everybody said, "You bet." And now Doug is great. He is a family man, and he and his wife like wandering the desert with their kids when he's not working. Thanks for being here, all of you. Let's start with Heidi. Are we getting a handle on opioids at all? It seems to me I saw some article just this morning that said maybe we're turning the corner. Are we?
Yes, I think efforts over the last several years are helping. You know, we used to be in the top 5 with opioid-related deaths. Last I heard, we were about number 2021. So things are getting better, I think, through a lot of public awareness and education. We've started some great campaigns, like the Use Only as Directed campaigns, lots of people reaching out, like we talked about in the last segment. Hopefully we're addressing that stigma in a way that's helpful, that's encouraging people to talk about this. So if that's shown us anything, it's that there is hope when it comes to opioid misuse and addiction, and I think our other panelists here are great examples of that.
It's interesting that, and I know we're going to get some people who say, well, you're demonizing opioids and I need them for, this. Nobody's trying to keep pain medication from people who really need it. But there's all kinds of evidence, multitudes of cases where opioids have been abused and misused and misprescribed. So, but it's interesting for me to note that opioid overdose deaths, we don't know a lot of times whether those are accidental or intentional, do we, Taryn?
No, we don't, and so we know that the link between suicide and overdose death, both of those numbers could fluctuate greatly either way, because we just don't know the intent oftentimes.
So let's talk to Tyler a little bit. Your experience, we touched on it a little bit in your bio. You had sports injuries.
As a young man, I got home off a mission and was doing everything I was supposed to do and was playing softball on the weekends and about 5 nights a week. And just remember having a lot of personal turmoil and lost my mom and had, the old adage of, you talked about it, Bill, earlier, you've got some mental health issues and depression. Well, maybe just work harder and you'll be fine. And in my family, we just worked harder. We didn't talk about things we didn't know.
I can tell you're kind of a stoic guy in general, aren't you?
Yeah, absolutely. Very
I'm going to
quiet.
keep it all inside, and and yeah, it hurts, but I'm not going to let you know that, and both physically and mentally.
Yeah, and similar to you, I lost a brother to opioid addiction. Like Taryn's talking about,
Would you hold that really close?
We don't know what that was exactly, but I had my own experience, and literally it was one time. Being introduced to a couple of Lortab 5s at a softball game, and essentially that provided a relief of my problems and a relief, kind of a warm blanket of caring.
My knee doesn't hurt anymore, and this is kind of a pleasant fog I'm in, and my mind doesn't hurt so much anymore.
Yeah, and that was really my experience, and it escalated quickly for me. I went from Lortab to Percocet to OxyContin, which was readily available when I was in my addiction, and OxyContin turned really quickly into heroin and cocaine, and the next thing I know, I was stealing everything that wasn't bolted down from everybody I could talk to, and ended up with a 3-year sentence to Utah State Prison.
It's interesting, and this does happen to people, I think, who go through what you've gone through, and they either don't survive or they become very zealous and get themselves educated, and they become counselors themselves. And I think it's probably very useful to have counselors who say, I know exactly what's happening here. I know how you feel. I know what's going on, and I can help you do that. And that seems to be your story.
Yeah, and along with Steps Recovery Centers, I also work for the Utah County Sheriff's Office. And it's wonderful to go both there, and I have had some opportunities to go to the Utah State Prison and walk in and say, hey, this isn't the worst day of your life. This could easily be the best day of your life. And this could be the point where everything turns around and all these lessons can be used for your good. Because if you can shoot heroin in your arm, you can probably market and do a little bit of advertising. It's kind of the same thing.
Let me just go. Just quickly, you said your brother, was it opioid or drug abuse and so you weren't sure what happened to there?
Yeah, we will never know. But he had some addiction issues and had an argument with his wife and was more talented, better looking than I'll ever be.
That's not possible.
But he was just I mean, of all the things, my family, my brothers, he was so fun to be around. But he just had an argument with his wife one night and overdid it and didn't wake up.
Not a mental health issue. Really not a mental health issue. It was family stress.
No, it easily could have been mental health things. I mean, he was a marijuana guy and believed wholeheartedly that helped him to some degree with his mental health.
That was my brother as well, yeah.
But wasn't willing to see counselors and do some of the other work. And I think that decision allowed him to make the decision to take too many pills that night. And we'll never know what that was.
Doug, what happened to you?
It started out with wisdom teeth. I was in high school and got another prescription. A few years later, I started taking Lortabs again, and my story is very similar to his. It went from Lortabs to Oxycontins to heroin, and again, I was stealing stuff to...
Did you steal stuff from us?
Sure did.
Yep, that's what I thought.
Sure did. And again, I think it was in an attempt to mask some pain. And
not just physical pain.
No, yeah. Mental pain. So after that, I pretty much hit rock bottom, you know. There was a point where I was homeless, and I had to make that decision. And I was lucky I had that moment of clarity where it was a fork in the road. I could stay here or I could go there. I also had a family member who had passed away from overdose, and that had hit me pretty hard. And that was kind of my moment where I said, okay, I need to...
You got yourself into a treatment program.
I did that early on. While I was working with you guys in the early days, I had the opportunity.
It didn't take?
No, it didn't.
Yeah.
But I relapsed many times after.
And I think that's an important thing to let people know. If you're listening and you've had problems with addiction and you relapse, don't just say, well, that's it. It was the same thing with me with smoking cigarettes. I can't tell you the number of times I quit. Sure. And then I just would have the pleasure of taking it up again. But finally, you make it. You keep plugging away at it, and you probably teach that in the Steps Recovery.
Oh, absolutely. And I think, we live in a culture, and especially a society locally, that's so shame-based. Yeah. And there's so much scientific evidence to some of the harm reduction pieces of really loving people, Bill, until they can love themselves. Yeah. I think that's one of the keys to this.
Before we leave this segment, we ought to talk about naloxone. And Heidi, I think you're probably qualified to talk about that. First of all, what is it?
Sure. So naloxone is a medication that can be administered when somebody is in an overdose. And so it's important that people understand that is available. They can get it through their doctor.
I understand you can actually even get it over the counter now.
Yeah.
Yeah, you can just go to the pharmacist
and say, pharmacist about that.
I need some naloxone. I have somebody in my family, and maybe it's you, but somebody in my family who is at risk of overdose.
Yeah, no doubt naloxone has saved many, many lives. It's also important, though, that we're aware that we're locking up our medications so that we can prevent some of that misuse and overdose in the first place. If we have those opioids, to lock them up and to also dispose of our unused medications once we're done.
I bet Doug went to people, when he was ever invited to people's houses, he'd excuse himself to go to the restroom, and then what would you do? Go through their...
Go through the cabinets.
Yeah, see what's there.
Yep. Many times.
I really have. I got stuff in my... I keep saying this. I've got stuff in my drawer at home that I was lucky. Wisdom teeth, that's my first exposure to opiates, and I found out that I was absolutely, totally allergic to them and hated them. It caused me to break out in hives, and so I probably would have gone down that road as well. I have an addictive nature because cigarettes was that. But naloxone, that's really an important thing, isn't it?
Definitely. And, going back to this thing with wisdom teeth and dentists, like we encourage this talk a lot with doctors, but it's important to have it with our dentists as well. My son just got his wisdom teeth out, and before he even had the procedure, he was given a prescription for 10 days worth of opioids. And so it's very concerning, and he ended up He didn't need those at all. With just a few Tylenol over a couple of days, he actually did just fine. But, we can have this mindset, I have this prescription, I have to fill it, and I have to do what the doctor told me to do when there is an alternative. So it's really important to be that informed consumer, have that talk, know what you have in your hand, and be responsible, know the risks.
We're going to take a break here again. We'll be back. We'll have some more panelists with us, and we'll talk about how this affects families. We'll talk about some other factors that go into suicidal thoughts. And thanks, Tyler, and thanks, Doug. You guys really helpful to hear those stories, I think. It's nice to meet you. And we'll take a break now, and we'll be back for a final segment.
It can be intimidating talking to your doctor about opioids. So don't think of me as your doctor. Think of me as your neighbor, an educator, a friendly voice of reason. Really, whatever makes you feel comfortable and happy. Because I want you to ask me questions, like if you're at risk for addiction. So let's talk. I'll make it easy for you.
Learn questions to ask and more at useonlyasdirected.org.
Well, we're back, and this will be fascinating because I really have no idea who most of these people are. These are guests that were introduced to me 10 seconds ago. So let's just kind of... Now, Taryn has stayed through all the segments. Taryn Hyatt, of course, is the Nevada-Utah Regional Director for the American Foundation for Suicide Prevention. I've worked with Taryn now for about 10 years and finally have gotten American Foundation for Suicide.
It's a mouthful.
I don't know why I've always, but I've got it now. But we have guests here that I don't know. Are you Craig?
Yes.
Craig Bryan, who is a clinical psychologist, a veteran, was served in the Iraq War, Executive Director of the National Center for Veteran Studies at the University of Utah, Associate Professor of Psychology, researching suicide among military personnel, and that's certainly a great topic to cover. You are, sir.
My name is Aaron Bergen.
Aaron, yes, I know. I have your bio.
Perfect.
Here. Hi, Aaron. Aaron started a website called Suicide Sucks. He's wearing the shirt there. This is an interesting approach to this problem, and we'll talk about that coming up. You are?
Pam Hayes with Stand for Kind.
Hi, Pam.
Hi.
Nice to see you. I do have your bio as well. Pam Hayes founded Stand for Kind 12 years ago, specializing in mental health, positive behavior, changing school culture. Particularly bullying is a large part of what you're looking into. She started a safe tip line 12 years ago, giving students a voice to keep them and other students safe. She's on various boards and committees. And are you Dave? Dave Tanner. So I didn't know Dave was coming exactly, but I do have something about it. Dave is also works for Stand for Kind. He's one of the ambassadors, mental health curriculum for students. Dave handling the leadership camps and training. So there, we finally got it all. I think I know who you all are now. Let's start with, let's just start with you, Craig. I'm glad you're here. How did you get here? Did you invite yourself, or did somebody just say, go down there?
No, I was invited a few months ago. We do a lot of work here in Utah and nationally on military veteran suicide.
It is a huge problem. People coming back from war in World War II, Vietnam, the Korean War, they would come back and they didn't know what was wrong with them, really, did they? Or actually, that's probably not true.
Yeah, the mental health field did not have a term for what we now call PTSD or post-traumatic stress disorder. Some of the older terms are like combat fatigue, shell shock, things like that. But now we understand the diagnosis and the condition a lot better, and we have some really good treatments, actually, that are very effective for treating PTSD.
And people who are suffering from PTSD, particularly veterans, but other people do suffer from it, from domestic violence situations and things like that, but they are at great risk for suicide, yes?
Yeah, PTSD is one of the strongest risk factors of all the mental health diagnoses, one of the strongest predictors and correlates of suicide. And so a lot of the work that we do up at the University of Utah with veterans as well as first responders. Now we're doing a lot of work with first responders. It really focuses on treating PTSD, and what we've been able to show in our research is that you can actually reduce suicide risk. And some of our treatments are now reducing suicide attempts by up to 76%. So they're very potent, very effective.
There are probably a lot of veterans out there who are suffering from this, and they don't realize it or they don't want to admit it, and their family members know something's wrong, but they're not quite sure what's wrong. How can they reach out to you? How should they handle that? What's the procedure?
Sure. So we actually have a clinic on the University of Utah campus, and we provide treatment for service members, veterans, first responders at no cost. It's all supported by donations and grants. They can call our main office. Our phone number is 801-587-7978. Or they can shoot us an email at ncvs@utah.edu. And we have a website, veterans.utah.edu, and they could fill out a form online and just submit it to us online, and we call them back usually within 2 days.
And it may be, it's your Uncle Frank, and Uncle Frank has been having all kinds of, oh, wait a minute, he was in Iraq, he was in Afghanistan. Maybe that's what it is. Contact these offices on behalf of your Uncle Frank and ask for advice. I think that's probably a way to handle those, yeah?
Yeah, and what we tell family members a lot is about 50% of our staff and the students who work for us, we're all veterans ourselves, and so sometimes that can help ease the kind of anxiety about coming in. If they're talking to a fellow veteran, usually what I tell spouses is if you can at least get them on the phone with me, sometimes I can at least kind of convince them if I can talk with them for 30 minutes, veteran to veteran.
This is going to sound like a joke, and I don't mean it to, but when I think when I got through with junior high school in particular, I felt as though I had post-traumatic stress. I felt shell-shocked by the junior high experience, and I think maybe that's a lot of kids feel that. Junior high seems to be a really rough time, maybe even 6th grade up, a rough time. Kids get bullied. They bully themselves sometimes in their minds, don't they, Pam?
They do, and that's one thing we focus on is self-care for youth. We need to look at ourselves, make sure that we're saying the right things to ourselves, that we are enough, we can do it, especially at sixth grade to 9th. It's a rough age. And a lot of things are changing, their hormones, and we want to train parents that it's just not a normal teenage thing. If they're depressed, if they're isolating themselves, we want to give them the risk factor so they can make sure they get them the proper help.
What is you have a line, Stand for Kind. You have a way that kids can call into that line. Is that?
We have a mental health module and resource where students can actually go through a course. They get training on different risk factors, what mental health is, anxiety, depression, and then it's a resource as well for them. So we have an app, plus they also go through the course.
Is this in all schools?
We are in almost all schools in Utah. We use our mental health. We just launched that this year. We're meeting with other states that have made state requirements where kids have to go through 5 to 7 hours of mental health training, and that meets that requirement.
And is that what you do? You handle some of those training programs?
Yeah, so I handle what's called the Ambassador Program. This is a group that's led by the students in the schools. What we try and do with these ambassadors is first make sure that they're in a good place themselves, right? If you think about, when you go onto an airplane and the flight attendant says, first put on your oxygen mask and then you can help others around you. We take the same approach with our ambassadors. So the first few months we're working with our ambassadors. We teach them about self-improvement, self-awareness. We talk about how exercise and nutrition can affect your mood.
Can I take this class?
Yeah, it'd be awesome. Please do, for sure. And then it's not until later in the year we get into kind of the leadership aspects, the suicide prevention and stuff like that. So.
This has got to be making a difference. The more kids you contact, the bigger, the most. I mean, it just seems to me that this is how we attack the problem of the epidemic of suicide. It really is. It's local, individual people. And it's devastating for people's lives, as Aaron Bergen can tell you. Aaron is, right, are you still a student at Gonzaga?
I am.
Yeah.
Finishing my master's thesis right now and basically being able to apply communication theories to somebody online that's in a crisis scenario. And hopefully to be able to prove that, a video from somebody that's relatable will help somebody take autonomous steps toward their own recovery.
This is an interesting thing I think you're attempting to do here. You have a website called Suicide Sucks.
Right.
And after your brother, as you put it, completed suicide, you were, of course, devastated by that, but then you decided to try and do something. And you created this website, Suicide Sucks. How does it work exactly? It's pretty interesting, I think.
So a lot of it's visionary in terms of what can we do. We know that we can predict suicide up to 92% accuracy based on clinical studies. A group out of the Florida State University and Vanderbilt have been able to prove this person will harm themselves in the next 7 days based off of some survey questions, typical survey questions in a clinician's office. I took that idea and that theory to be able to then apply. Amazon has a facial recognition program now where it can detect emotions and what state you're in. So as technology continues to evolve, we're going to be able to not only predict who's going to hurt themselves, but also then prescribe, based on the knowledge that we have about that person, which type of video or story would help that person feel encouraged, feel less alone, and give them access to the help and support that they need.
So what you're trying to do on your website is if people who are feeling down and thoughts of suicide, if they go to the website, there will be videos available there of people who've had similar experiences.
Right. Ultimately, the technology is outside of my brain power. I've seen that it's possible and it will be the future. And to me, I wanted to say, well, what's the next step? The next step is once the computer knows who's suicidal, knows what the condition is and what whether they're a veteran or whether they're a police officer or a firefighter, then be able to find the right content.
It's all an algorithm.
Right. So it's our responsibility now, those of us that have experienced these difficulties, these traumas, to share our stories, to get them out there online. So when the algorithm goes to look for the right matchup, that'll be there.
It's what we sort of attempt to do in a really small way by having Doug and Tyler, and somebody else can say, yeah, I did. That happened to me. Taryn, how important is all of that stuff?
Well, I think the things that we're all talking about, and really what we're trying to create is connection. We're trying to connect with people who they can relate to. That's what Craig does so well. That's what you're helping to do in the schools. That's what Aaron's hoping to do. And in that last segment, the thing that just kept resonating in my mind is, again, when we connect with another individual, we share our story, they know they're not alone. When we look at individuals, especially when it relates to, addiction, a relapse is such an important time for us around that individual to be mindful of them, because that's when their risk for suicide, again, is high, because they're already feeling that shame and that guilt from experiencing, a symptom of their disease, where we can rally around that person and, again, love them and connect with them. And I say it all the time, but I believe it to be true. Connection is one of our best forms of suicide prevention. If we can let people know that they're supported, that they're loved, that they're not alone, it's not the cure-all, but this is a great step for us to, again, start that conversation to hopefully help save their life.
Yeah, from the academic perspective, there are really three main factors that we've identified as being able to give someone the ability to harm themselves fatally. And the first one is thwarted belongingness, like they don't have an ability to belong, or they don't feel like they can belong. Yeah. Second is a perceived burdensomeness, whether or not they are truly a burden to the people around them. If they feel like they're too much of a burden, they'll take their life to relieve that burden of the people they love. And the third one is really the capacity. And the capacity to harm yourself really comes from a traumatic experience or something that breaks your intuition to save your own life, right?
It's fascinating. I look back on my own young life, and it was not I don't want to be dramatic about it, but I had plenty of struggles growing up, and felt isolated and alone. But I have to say, I probably never felt that it got to the point where I would say, well, I don't want to be here anymore. And yet somebody else experiencing exactly those same feelings that I was having would go the other way. And I try to be really careful these days and say, instead of saying, geez, I'm so depressed today, I'm not depressed. I'm just unhappy. I'm just feeling a little down. Depression is something entirely different from that. And You know, we all have these feelings, and kids, you know this, kids all have those. Even the most seemingly popular kids have feelings of, I'm not good enough, I don't look good enough, I'm not trying hard enough, and yet most kids pull through. They pull through and they say, well, you know, I'll just go on and keep plugging away, and they do, and they're fine, and they end up being fine. But we need to reach out to those that aren't. Are they hard? Aaron seems to think they're fairly easy to identify. Is that the case? I mean, I had no trouble. I mean, I had no idea, although as I indicated in my intro, it's maybe my fault because I wasn't thinking about it enough. But I had no idea my brother would do something like that. I couldn't identify it. Are there ways to?
I mean, it definitely seems situational. In some instances, you might be able to recognize it sooner. If you have a friend that's like, man, if this doesn't happen, I'm going to kill myself. That's pretty obvious, right? But I know a lot of other people just kind of bury those emotions real deep, right? And you can't really tell, like you mentioned. So for me, it all is just situational, kind of what we talked about, trying to make those connections as best we can. Will open up opportunities to be more aware of those situations when they do happen.
Yeah,
right?
there are any number of ways to reach out. Taryn, why don't you give some of those numbers and ways that people can reach out and if they need help, and there are lots of ways to do it.
Yeah, I mean, obviously one of the easiest, and we know that's available to everybody 24 hours a day, 7 days a week, is the National Suicide Prevention Lifeline. So 1-800-273-TALK, which is 8255. For veterans, they can press 1 when they call that number, but you're routed again to your local crisis center, and anyone can access that from anywhere. Obviously, there's behavioral health hospitals, you know, and drop-in centers that you can go and visit. You know, an emergency room is always an opportunity to get somebody immediate support. The text line, the Safe UT app, you know, again, what a great resource for people to be able to chat with somebody immediately, but utilizing those key resources.
Some questions that have been texted in, and we still have a few minutes. If you want to text a question to 33986, we can get to it. This question, and anybody can, how can I reach out if I'm scared and my family will shun me because they think I'm being over dramatic? That sounds like a very young person. I'm being over dramatic. Yeah.
Yeah, this is something actually that we've researched a lot up at the university. You know, it's a concern that many individuals have, especially teenagers, adolescents. And one of the things that I've talked about with teenagers who have that concern is, you know, when you're having these suicidal thoughts, you know, what is that about? What are you thinking that suicide might be able to do for you? And what we find is that the most common response is, I think it will help me solve a problem or will alleviate my stress. And so a lot of times I sit down with teenagers and say, so let's talk about how you can communicate your pain and your stress to others. And sometimes some people won't respond in a helpful way. That's unfortunately a part of life. And so let's maybe find who are the people in your life. Perhaps it's parents, perhaps it's teachers, perhaps it's some other adult in your life who may be more helpful than some of the ones that you have in mind right now.
We have another question. Even with insurance, treatment is too expensive. What do I do? Yeah.
You know, that's the reality that we face, you know. So I would recommend groups like NAMI, the National Alliance on Mental Illness, offers free support groups, classes, education. There are a lot of therapists and places that do a sliding scale fee. Again, it's not always easy to access mental health resources. We know that, and that's an area that we really need to work, you know, and Senator Thatcher can attest. This is something that's on our radar. We know that we need to improve access to care and the systems of care. But know that there are free resources available. You can have a free 24-hour assessment at places like Salt Lake Behavioral Hospital and other avenues that if you're in immediate crisis, you know, there is help available to guide you, but there's also some free places that can support you as well.
Here's another question. If it's an accidental overdose, and I don't know if any one of you can answer this or not, does that reflect in the suicide numbers, or do they just think, oh, that's just a junkie?
So there's the CDC several years ago released a report that provides very kind of firm definitions of what suicide is versus not suicide, so accidental overdose, for instance. And also the medical examiner and other individuals involved in death processes are familiar with these concepts and with these definitions. And it's not an exact science, but this is typically how OME and others will approach that issue, is they look for other evidence or other indicators from the person's life that would suggest, was this a deliberate, intentional act wherein the person wanted to die as a result, or it might be deliberate or intentional, but perhaps they did not expect or want to die, in which case it would be classified as an accidental death.
Sometimes it's a judgment call. Is what you're saying.
Yeah, it is. And as a researcher myself, we have meetings actually constantly trying to figure out, does this count as a suicide attempt or not? And it's not always clear, especially post-mortem. If someone has already died, you don't necessarily have the opportunity to ask them what they were hoping for or what was going through their mind at the time that they engaged in the behavior.
I read this earlier. It says in the intro, 27 states use something called the National Violent Death Reporting System. Is Utah one of those states?
Yes.
And why don't all states do it?
Because there wasn't funding. This is something that we as AFSP and advocates, for years have advocated at a national level that all states be fully funded in this system. And it wasn't until, I believe, last year that some of that funding started to come through. So we'll start to see this happen in all other states. But again, if we don't get real-time data, how are we going to really know what the issue is? So we need this funding. We need it to happen, and we need it to be sustained.
Yeah. Same thing true with the 911 type number for suicide, for a suicide hotline, essentially.
Yeah, I mean, we've looked at and again advocated for a 3-digit number nationally. The FCC has indicated a number that they want to use. However, we know that we need to make sure that we roll out the right number. We want to make sure it's one that everybody has access to, that the funding is in place, that the systems who are going to be taking those calls have the staffing necessary in order to handle the volume that we will see. But a 3-digit number is on the way, again, thanks to the good people here in the state of Utah.
Well, I heard Chris Stewart yesterday say that it was all his idea, and that he was sure that the number was going to be 988.
That's what they've designated, but we want it to be the right one. So
that's not the right number.
I don't know yet.
Well, I mean, it's 988. That doesn't quite doesn't roll off the tongue like 911 or 211 or. Why couldn't we use 811 or 711 or 611?
That's what we're still talking about.
Yeah. But 988 seems a little. But it's better than not having any number at all. Yes.
Sorry to interject here.
Please.
I've had the last 10 years to reflect on what I would do differently, and I think there's a lot of people in the audience that are dealing with people that are going through some severe issues, some depression, some anxiety, and even attempts at self-harm. And one thing that I've been so surprised by was how many resources and education into what the signs are and what does it look like and how do you respond as a responder. But I didn't know all that until after I had a severe incident in my life that motivated me to act. And if I had anything in the world to give to go back and look at my brother's life differently, and kind of how you've mentioned, be more observant and actually recognize the correlations between what the signs are, what they look like, and what the indication of risk really is, that I think things could be a lot different.
Yeah, I clearly was too self-absorbed. I knew he'd lost a business, and it was tough on him, but I just didn't give it enough thought.
We have one of our speakers that he suffers from depression, and he was told all growing up in high school that just be happy. You can be happy. And he's like, it's like this switch in my head. I can't turn. I can't flip it as much as I want to. Yeah. I can't flip it. And so we got to recognize the signs and then get them help.
We're about out of time here. The discussion should continue. It can continue. If this is just put more questions in your head or you're seeking help, again, one of the best ways to do it is?
Yeah, call the National Suicide Prevention Lifeline. Again, those calls are answered here locally at University of Utah, but 1-800-273-8255.
For those of you who contacted me earlier today, 33986. Text that number, and I'll get back to you as quickly as I can with your questions. That's it. We're out of time. I'm Bill Allred. Thanks to everyone at Broadway Media who worked and made this possible. Thanks to all of our guests, Senator Thatcher, Will Levitt, Heidi, and Tiffany, and everyone. Thanks you all. Don't forget that the walk for Out of the Darkness is next Saturday at Liberty Park. That's it. I'm Bill Allred, and we're out.